Well, good afternoon, everyone. And my name is Shelley Worley, and I am the Director of Health Promotion for Summit County Health Department. SaRene and I are excited that you have joined us today. This is our first virtual open house. We hope that you're going to be able to learn quite a bit about diabetes and diabetes prevention today. Throughout the presentation, at any time, if you have a question, you can either type it in the chat box. There's a chat box down at the bottom. If you click on that, you can type in your message, your question there. You can do that at any time during the presentation. And then when we have a pause during the presentation, we can answer that question. Or you can wait and ask during one of the breaks in between different sections of the program that SaRene has for us today. So feel free to list your questions. We'll get through them. More than likely, if you do have a question, someone else has the same question. There's a lot of information about diabetes, so I'm sure there are plenty of questions. SaRene Brooks, who is our diabetes educator, will be doing the presentation today. SaRene has been a health educator for Summit County Health Department for over 5 years. She's a registered dietitian and a diabetes care and education specialist. She focuses on chronic disease prevention in Summit County, specifically coordinating the diabetes prevention program and providing education for diabetes management. She enjoys educating others and watching their positive outcomes. I've worked with SaRene for the last 4 years, and she's amazing with diabetes education and really cares about the participants in our class. So I hope you enjoy this presentation today. And if you have any questions, just feel free to post them.
Yeah, thank you, Shelley. We are excited to be here, and thanks to Bailey for helping. Bailey Edelstein helped get this set up. So I appreciate her efforts in helping us to get this virtual open house set up. And we're really excited to be able to present a little bit of information about diabetes. It's something I have lived with, not me personally. I don't have diabetes, but 2 of my children have type 1 diabetes. I was raised in a home with a father with type 1. I have other close family members with diabetes, as well as extended and close family members with type 2 diabetes. So something I have seen a lot of and worked a lot with just within family and friends. And over time, I have learned that it is something that can be managed. It's something that can be prevented or delayed if you are at risk for type 2 diabetes. And so it's something I feel strongly about sharing information, because I feel like there's so much that can be done and so much education that people can gain about diabetes that can really help bring positive outcomes. So I'm excited about the work that I am allowed to do here at Summit County, and excited about this open house today. So we're going to start out by talking about what diabetes is. And I feel like the more you understand about what diabetes is, the more it makes sense why people treat it the way they do, or why people manage it the way they do, or if it's you that has diabetes, why is it that you're asked to do these certain things? But I feel like education is a really big part of really understanding what diabetes is. And so I really like to do a quick overview on that. First of all, I'm going to talk about type 1 diabetes, and I'm going to start with the very beginning of when any person eats a meal or a snack. The carbohydrate part of our food, if you eat a carbohydrate, it will break down into a simple sugar called glucose. And that glucose enters the bloodstream, as you can see in this diagram here. And this glucose is the preferred energy source for our body. So our body likes to have the glucose that we get from carbohydrates. It breaks down, it goes in our bloodstream, it's easy to use as energy. And so carbohydrates play a really important role in the energy source for our body. But in order for that glucose to get out of our bloodstream and into the cells of our body, and be used for energy, we need something called insulin. So when we eat a carbohydrate, our body signals to our pancreas that we need some insulin. The insulin goes and allows that glucose to come out of the bloodstream and into the cells to be used for energy. So this is what function happens in everyone. Now, someone who has type 1 diabetes, they no longer produce insulin, and it's an autoimmune disorder. It's good to understand that their immune system has attacked their pancreas, and their pancreas is not able to produce insulin. And so there's no way to get that glucose out of their bloodstream. And so it builds up quickly. Their blood sugar levels get high quickly when that insulin production has ceased. And so as you can see by this picture, that glucose isn't getting out to the body and used for energy. Now, type 2 diabetes, this is why it's kind of confusing. The names are so similar, is we go through the same thing when we eat. We use insulin to get the glucose out of our bloodstream, but someone with type 2 diabetes, they are still producing insulin, but their bodies become resistant to the insulin they're producing. And so see how there's some insulin there, but the glucose isn't getting out of the bloodstream. It's just because they are not using their insulin efficiently anymore. And so it may take more insulin to actually be able to use that glucose for energy. And over time, the pancreas having to produce more and more insulin has a more difficult time keeping up with it. And that's when blood sugar levels start to elevate on somebody with type 2 diabetes. So with that little brief explanation, are there any questions on the difference between type 1 and type 2, or what happens in the body with type 1 and type 2? Anything anyone can think of, or anything they want to share about diabetes in general and what's happening in your body?
SaRene, I did have a question from an individual, and they wanted to know if there are certain symptoms for diabetes that you can recognize.
Okay, this is a great thing to talk about. A really great thing to raise awareness for, which is what I'm hoping to do today. Type 1 diabetes does have symptoms, and they come on fairly quickly, but sometimes you don't recognize them right away. But just being aware that those symptoms, things such as increased thirst to where you get a drink of water and you're still thirsty, frequent urination. You'll see with, especially, a young child would normally not get up during the night to go to the bathroom. They'll get up 4 or 5 times a night, maybe. Those are the two really big immediate symptoms that you see. Over time, you will see blurred vision, weight loss. They're kind of the two next ones to come around. But it's because that we talked about, they have no way to get that glucose out of their bloodstream. And so it just keeps getting higher and higher. So think of every meal they eat, that sugar is just staying in their bloodstream and no way to get out. And so because that escalates quickly, it's really important to recognize the signs of type 1 diabetes and seek medical attention immediately. It can be diagnosed with a simple blood test, and it's really important to act the second you notice those symptoms, and to not wait, because it can be dangerous if they continue to get higher. So that's the symptoms of type 1. Type 2, you don't see so much that. It happens gradually. You don't usually feel a lot different. And so, and part of that is because there is some insulin being produced. And so some of the sugar is getting out of their bloodstream. So they may start having mild symptoms, but typically right at diagnosis, people don't even know that they have type 2. And that's why it's really important to ask a physician when you go for a physical to have a blood test done and know what the results are and understand what your blood sugar levels are.
So one other question, and this is one that we get often, is does type 2 only happen to people who are older or making poor lifestyle choices?
So type 2, you typically, in the past, we've always thought of it as someone who's a little bit older, but they are seeing type 2 in younger children, even maybe into, teens, as young as teens. And some of the reason for type 2 is just a genetic. Some people are just going to get type 2 diabetes. They have a genetic inheritance for it. And so I have seen people who are active and otherwise healthy, they eat well, they're in a healthy weight range, and they have type 2 diabetes. Other people, it is a lifestyle. Can be caused by lifestyle, by not being active enough, or maybe not eating appropriately, and then they can get into that insulin resistance. And so it can be lifestyle, but quite often it can just be a genetic thing that they really can't have any control over. And so that's one of the reasons why it's so important to always be active and be careful of what we're eating and watching how we eat, just so that we can help maybe prolong that if we are at risk for it. Those are great questions. Okay, well, I'm going to move on to talking about prediabetes, because this is also really important to understand. When someone has prediabetes, it means that their blood sugar level is higher than normal, but it's not high enough for the doctor to diagnose them with type 2 diabetes. Now, prediabetes does not apply to type 1 diabetes. As we talked about before, it's an autoimmune disorder. We don't really know what would cause it or how to prevent it. But prediabetes puts you at risk for type 2 diabetes. And really the alarming part of this is that 1 of 3 people, American adults, have prediabetes. And so that means they already have that little bit of insulin resistance. Their blood sugar levels are a little bit higher than normal. But as you notice with this graphic here, 9 of 10 people with prediabetes don't know they have it. And that's because they don't have any symptoms. It comes on slowly. They just have a little bit of elevated blood sugar level, but they don't know that anything's wrong because they don't feel sick. And so really, to know you have prediabetes would come with a diagnosis with a blood test from a physician. And it is an actual diagnosis now. And I'm glad that they've made that change and had it a diagnosis, so that people can know that they need to go in and get help, and they can go join a program or meet with a professional to find out what they can do to lower their blood sugar levels back down to a normal range. Because you don't feel different, a lot of times people don't feel this urgency to go in and see anyone because they still feel the same and their blood sugar levels aren't high enough for diabetes. So I feel like that's an important thing to remember, is if you do know you have prediabetes, you really want to make sure you seek help and do something about it. Now, there's also a way to see if you're at risk for type 2 diabetes. I find this really interesting. Not only does it tell you if you're at risk, but it also tells you what things put you at risk. So you can follow along and add these points up in your head if you want. You look at your age. You go by your age. 40 to 49 is 1 point, and so on. If you're a man or a woman, men are more at risk for type 2 diabetes. If you're a woman who has ever had gestational diabetes when you were pregnant, you get a point. If you've ever been diagnosed with high blood pressure, you get another point. If you're physically active, 0 points. If not so much, you'd add a point. And then you look at your weight category. And that first column gives you 1 point. So find your height, go over to the weight. First column is 1 point, second column's 2, third column's 3 points. And if you're less than that first column, you don't have any points. So you can see you can quickly add up those points. If you score 5 or higher on this risk test, then that just means you're at risk for type 2 diabetes. And I like that this is a really simple, straightforward way to look and see the things that put you at risk. There's several risk tests out there. They're very similar. They ask similar questions. Some of them include maybe genetics or family history. They all basically come down to about the same thing. And you can just Google search diabetes risk test. The American Diabetes Association has one. The The CDC has one. So if you find out that you're at risk for type 2 diabetes, this would also be a good time to say, oh, now I need to maybe go in the doctor and have a blood test taken and see if I actually have prediabetes. Now, I know people who are at risk for type 2 diabetes and don't have prediabetes. I also know people who have prediabetes and they'll take this risk test and score under 5. So you really have to look at either one of them as a sign that you would want to take action and go in and see what you can do, meet with a professional and see what you can do. Does anybody have any questions on pre-diabetes or kind of what that means or what you could do about it?
So there is one question regarding parents. If one of my parents has diabetes, does that mean that I will also have diabetes?
That's a great question. So this is a really common thing that people will ask. So because a lot of times you have a family member with type 2 diabetes and you've watched them, especially years ago, we didn't really understand everything that was happening in the body when they had type 2 diabetes. And so it was really difficult to treat it. It was hard to manage it. They didn't understand the role of carbohydrates. At one time, they thought it was just sugar. And so people would cut out their sugar intake, but they would eat lots of carbohydrates. And so we would see people with really poor health outcomes and lots of damage to their bodies. You hear of amputations and neuropathy and all the things that happen. And people get nervous because their parents dealt with this. And so now they don't have type 2 yet, but now they're worried they're going to get it. So it definitely puts you more at risk, and it's something you would want to understand better what you can do to prevent or delay it. But it also doesn't mean you need to worry that you are going to get it. And sometimes it's genetic, and sometimes it really can go back to the lifestyle choices you're making. So that is really why it's important to always be aware of the things you can do to be as healthy as you can and make the best choices that you can so that you don't fall into that type 2. Any other questions anybody has? The good news with pre-diabetes is there are things you can do to prevent or delay type 2 diabetes. And so I feel like it's really important to understand what you can do to help prevent or delay type 2 diabetes. Used to be that people's blood sugar levels would elevate a little bit, and then a physician would just wait until they're in the diabetes range. And then they would say, oh, now you have diabetes, let's get you on medication. Because that was really the only way they understood that they could help control blood sugar levels. Now they know that lifestyle changes can delay or prevent type 2 diabetes. There are proven things you can do to help to improve your outcomes. So think of the things we talked about earlier. There's things we can't control. We can't control our age. We can't control if we're male or female. If we can't control our ethnicity, our genetics. There's just some things that will put us at risk for type 2 diabetes that we can't control. But thinking of the factors that we can control, that is where they concentrate on with diabetes prevention. And that would be things like our level of physical activity. We can control how active we choose to be. And I do realize that there are some limitations people have to the ability to be active, but usually we can find something they can do to be active. And so physical activity is usually a choice, as well as maintaining a healthy weight. So when I say maintaining a healthy weight, I don't mean that you need to go on this big diet and lose a whole bunch of weight. I don't mean you have to be really thin. I mean, as little as 5% weight loss has been proven to delay type 2 diabetes. So that's encouraging. That's not usually a lot of weight for most people. And as little as 150 minutes of physical activity equivalent to a brisk walk is enough to prevent or delay type 2 diabetes. So to me, that is really encouraging that you can take these steps to make lifestyle choices that could make such a big impact. And I have seen people do really small steps towards that. And I have seen them make really big changes just by making those small steps. So I feel like it's really exciting that we know and understand that there are things that can be done to delay getting type 2 diabetes. So this would be a time to pause as again, if anyone has any questions on lifestyle choices or things having to do with delaying or preventing type 2 diabetes.
SaRene, you mentioned 150 minutes. Is that per week? Is that every 2
Yes, I
weeks?
should have been more clear. 150 minutes a week and of physical activity. And it doesn't have to be a brisk walk. A brisk walk is when you're walking fast enough that your heart rate is elevated, but you could still carry on a conversation with the person next to you. It could be a bike ride, it could be swimming, it could be any type of physical activity, but 150 minutes a week. And I'm not saying you should do 150 minutes in one day and call it good for the week, right? You should do 20 to 30 minutes a day, 5 to 7 days a week of some type of physical activity. And if you have to divide that into 10-minute chunks each day, you start where you're at. If right now to you means you go for a walk around the block each day, great, go do that. And then gradually add to it. Maybe you take a slow walk down the driveway and up the street. And maybe in a few weeks you go a little bit faster. But if you can build up to that 150 minutes a week and just make it part of what you do, that makes a really, really big impact, not only for diabetes prevention, but any type of chronic disease prevention. I can't even think of almost anything you could do better for yourself than to be physically active.
And then one other question is regarding weight management, especially for someone who's tried to lose weight in the past and they get frustrated because they tend to put it back on and then they have to go try to lose it again. What do you recommend for trying to keep weight off?
Yeah, that's a really common thing that I hear from lots of people. And so diabetes prevention, because weight does play such a big role in preventing diabetes, it is important, but weight loss isn't the only thing, and it's not meant to be a stress or something where someone feels like they have to go out and go on this big diet and be miserable for the rest of their life because they don't want to get diabetes. So weight loss is tricky and it needs to be done correctly. And then you need to be really vigilant after that weight has been lost in order to keep it off. And that is why I like people to learn about lifestyle changes that they can make in their everyday life that they can do for the long term. Things that aren't miserable, something that doesn't make them unhappy every day of their life, and they don't have to worry about every single thing they put in their mouth, right? We just learn how to incorporate healthy eating choices into our everyday life that we can maintain over a long period of time, because that's when you see sustainability in weight loss. Is if you're doing something you can do for a long term, then that weight will stay off. You know, you incorporate physical activity into your everyday life and you do it. That's just what you do. You incorporate some healthy eating changes into your life and you just continue to do them, but they're things you enjoy doing and it's not miserable. That's how you can do sustainable weight loss, because it can be very frustrating and it's really hard on your body to lose a lot of weight and then keep gaining it back. So it's really, really important to seek professional advice when you're losing weight so that you can find a way to lose it where you can keep it off. Okay, those are great. Let's move on to talking about helping other people who have diabetes. I always feel like this is a really important part of awareness for diabetes, which is part of why we wanted to have this virtual open house, is so we could just raise awareness for diabetes, because it is a little bit confusing if you haven't lived with it or don't have it yourself. And sometimes we have we just misunderstand what it is. And we kind of misunderstand what people are doing when they're dealing with it or how they are managing it. And we don't really know how to help them. And so I feel like it's really a really important piece of diabetes is just understanding how to support other people who have it or supporting other people whose family members have diabetes. It's just it can be a really difficult thing to deal with for people who have it. Um, they have it 24/7. They have it every day. There's no taking a break from it. There's no saying, you know what, today I'm just not going to bother with that because I don't feel like it. Someone who has type 1 diabetes, they have no choice but to take insulin every time they eat. They have to test their blood sugars frequently. Um, they learn how to count carbohydrates. It just becomes part of their daily life. They have to wonder if they're going to go low when they get in the car to drive, and so they're testing, or they wear continuous monitors that tell them where their blood sugar levels are all the time. Um, when they go somewhere by themselves, they have to make sure they have lots of things with them in case they need to eat something. So there's kind of a lot of emotional part that goes with diabetes. And I was using type 1 as an example, but type 2 as well. Someone with type 2 is still working to manage their diabetes. They're still counting carbohydrates. They're watching what they eat. They are trying to get that walk in every day, like we talked about. Physical activity helps our body use our insulin more efficiently. And that's why it's a preventive measure. And that's why it's a management measure as well. So people who have diabetes, they're doing the same thing. They're trying to be active every day so they can use their insulin more efficiently and can keep their blood sugar levels down. And so it's really important I feel like it's really important to understand what maybe a close friend or family member is dealing with when it comes to their diabetes. And being able to support them would be really important. Doing things like sitting down and having a conversation with them and asking them, what is it like to have diabetes? What do you do every day to manage your diabetes? Let them talk to you about their diabetes. Let them maybe vent to you once in a while about their frustration of their diabetes. It could even be a close family member who you feel like you understand what they're doing, but really to ask them once in a while, like, tell me what it's like. Tell me how you feel about it. Tell me what I can do to make this easier on you. Because I think the more we understand that, the more we can help them. Especially if it's a friend and we're in social gatherings with them, then we can understand better how to treat them in a social setting, or as a friend, if they need to have someone to call and visit with about it. Or maybe you know someone who has a young child with diabetes, to call that person and just say, can you tell me what it's like to have a child with diabetes and how I can help you? Because it really, like I said, it's an emotionally exhausting thing to live with. And the more people around you understand what you have, the easier it is to manage it and to cope with it. And then also it will help you understand what you can do for them. So someone with type 1 diabetes, I especially think of them as really needing actual physical help. Sometimes if they should go low, ask them what to do. Say, what do I do if I'm with you and you're going low? What is the best thing I can do for you? Because that is probably one of the easiest things you can do to help someone with type 1 diabetes. But most people don't know what they're supposed to do. And so they're nervous and they're scared. If you get in a situation with someone with type 1 diabetes and you've never had that conversation, it would be scary because you wouldn't know how to help them. So just really helping, and then also being supportive and non-judgmental of them. I know we discussed earlier about there's kind of this thought where people get type 2 diabetes, they brought it on themselves. It's their own fault. They didn't make good choices. They're not healthy. So they have type 2 diabetes, but that's not always the case. And even if it is the case, they still have type 2 diabetes, and we still want to support them and be non-judgmental about the condition that they are dealing with, because it is still a stressful thing. And, maybe we can invite them to go for walks with us, or we can ask them, oh, well, if you're trying to be more active, how would you like to go for a walk together? So there's lots of things we can do to support people with diabetes, but definitely do not be judgmental against them, because more than likely it did start because of just a genetic thing, or maybe they just didn't even realize the choices they were making were hurting their health. So being really supportive can go a really long ways for helping those around you who are somehow impacted by diabetes. Does anybody have any questions on supporting people around them with diabetes?
I don't see any questions, SaRene.
Okay, great. I always like to hear how people get involved with those around them with diabetes. And I've seen some great things in people around me who have jumped in and really tried to help others. And I think you can easily have a conversation with someone, and I think they would feel really happy that you were concerned about them. And on the flip side of it, if you are the one that has diabetes, feel comfortable and confident in asking those around you for support and talk to them about it. Most people really just don't understand what you're doing to manage it. And because everyone manages it differently, have that conversation with your family and friends so they understand better what you are doing to manage your own diabetes. And it would make things easier for you as well. So let's talk a little bit about what you can do to get involved if you are dealing with diabetes, or maybe you have pre-diabetes. The Summit County Health Department offers some programs. I'm really excited about them. They've grown over the last few years, and I have loved seeing all the progress people have made as they go through these programs. It's just been amazing watching them take little steps and see these great outcomes. It really is exciting to me. I love this part of my job. We offer a diabetes prevention program, and it is a lifestyle change program that is aimed to delay or prevent type 2 diabetes. And I always like to use the word delay or prevent, because some people genetically will eventually get type 2 diabetes, but if you can delay it even for a few years, it will be so much better off. It will be so much worth the effort to do. This program is led by trained lifestyle coaches, and you have support of other participants who are doing the same thing that you're trying to do. And it will teach you about physical activity, weight maintenance. We talk about sleep, stress management, and lots of other aspects that influence the risk for diabetes. And I love the program. I love watching the participants interact and learn, and just these really, like I said, really small steps to preventing diabetes. Research has shown that a structured intervention can cut the risk of type 2 diabetes in half. So that's pretty big. And if you know you have prediabetes, like I said before, you're one of the lucky ones that know. So there's no better time than now to take action and make those changes to get your blood sugar levels down so that you can prevent or delay type 2 diabetes. We also offer diabetes self-management education. We have an accredited program where you can meet one-on-one with a diabetes care and education specialist, and you can learn ways to manage your own diabetes. It's so different for everyone. Everyone has their own things they're trying to do, things that are more difficult, obstacles they run into. And it's not just a one-time thing to talk to a professional. If you already have diabetes, you've probably already talked to someone about it. And it's not necessarily just this one-time thing and then you're good to go. You run into obstacles throughout your whole life. So if you have diabetes, even if you've had it for a long time, meeting with a specialist can really help. There's a lot of benefits to the self-management education. It's been proven to reduce healthcare costs, lower your A1C score, which is your blood sugar levels. It makes a positive impact not only on the clinical aspect, but the psychosocial and behavioral aspects of diabetes. And really important part is reducing the onset or advancement of complications. And an important thing to remember about complications to diabetes is just having diabetes does not mean you are going to have complications. It's having diabetes with high blood sugars and not having those blood sugar levels down to a safe level that brings the complications. So I feel like that's really important to understand, that working on that self-management is important, because just because you have diabetes does not mean you have to have the complications that can go with it. And then it can bring on improved quality life, and it gives you a support system. The people I meet with, it's great. I can support them in what they're doing. We can talk about things. They can touch base back with me later. So having that support from other people can make a really big difference when it comes to managing your own diabetes. So this is also a really great program, and currently all of our programs are offered virtually. We are not meeting in person right now. Someday I'm sure we'll be back to that, which is great, but I've seen some really positive impacts of the virtual meetings. It's flexible, and so they're still just as beneficial, but they are all virtual right now. Does anybody have any questions about the programs that we offer here at the health department to prevent or manage diabetes?
One is how do you sign up for either of these classes that you just talked about?
So the best way to sign up would be just to contact me through the health department. And I'm just going to put my contact information here. You could call the health department and they would also know how to reach me, but to just call me or send me an email. Or you could also visit the summitcountyhealth.org/diabetes on our website. If you go there, it will also have contact information to call. I can give you information on upcoming classes, if it's diabetes prevention, if it's for self-management education. We can talk about scheduling an appointment to meet at a convenient time, and that would be the very best way to find out any information about either of these programs.
Just one final question, SaRene. With the diabetes prevention program, that's a pretty big commitment. Are you required to attend every class, or what happens if you can't attend a class?
Okay, yes, that's a great question. And the program is a big commitment. It is 22 sessions long. And I know that sounds like a huge commitment, but I have yet to teach a class to where when we finished, people weren't saying, oh, that went so fast. I can't believe we're already done with this class. And I don't know what I'm going to do now the class is over, because I'm so used to having the support from each other. It's really a fun class. We do 22 sessions. It spans over a year. So it's spread out throughout the month, and we meet more frequently at first, and then eventually we get to where we're just meeting once a month for about 50 minutes. But it's a great class. But yes, it's a big commitment. So if you cannot make each class, we have the ability to make up the information. We have recordings you can go on and watch and listen, that you can just get the exact information again virtually. You can get it, just on your computer by listening to the recording. And so it's really easy to make a session up here and there. If you're not able to make it, we're really flexible on that. And then we really try hard to make these sessions set up for when the group it's best for that group time wise. So we have lots of flexibility on time and day of week. So we try to make it as easy as possible to get all the information and do the whole program. And it is a longer program because it does take a long time to make those lifestyle changes. It takes over that year. Even when the class is over, you're still trying to figure out how to make those changes. So it's a long process, and it gives you time to kind of have a chance to get those things down and really work on make those changes before you're kind of left on your own. So great question. And if anybody has anything else that they want to ask or share, we're happy to share that as well.
I do not see any other questions.
Okay, it looks like that's it, and we're right at our time. And so I appreciate you joining us today. Hopefully you have learned something more about diabetes today, a little more aware of what it is. And please reach out to me or any of the health promotion team at Summit County Health Department if we can help answer more questions about this. And if we can give you more information, I'm happy to talk to you about it, even a conversation on the phone, to decide if there's something that we offer at the health department that would help you with your diabetes, or if you even just have more questions about the things that we talked about. I'm happy to have a conversation. And if not, I appreciate you joining us